So we commissioned this research from an organisation called Inside Out, which is Dr. Norma Barry and Rhian Bowen Davis. And I'd like to start by thanking them and paying tribute to all their work for producing such excellent evidence and thoughtfulness in terms of the report. The research was conducted between November last year and January this year, and it covered the issues of abuse under the Valda SV definition of abuse and financial abuse as well. The research was shared with myself as the Older People's Commissioner for Wales, and also our abuse steering group and action group. And the research included a number of recommendations, which I'll reflect on later. The purpose of it was to undertake a comprehensive mapping exercise of the services throughout Wales to support older people experiencing or at risk of abuse, to identify the availability and types of services being delivered in Wales, and to consider whether the support currently available is sufficient to ensure older people can access the help they need when they need it. So if we could just pause the slides for a moment, please, because I think they're going slightly quicker than I am. So I'm just going to ask my colleague Kay just to go back to the slide on older people experiencing abuse. That's the one, thank you. That's the one, thank you. So it showed that there is a great deal of underreporting of abuse and a lack of age-specific data. In other words, the data that records people who are experiencing abuse or who are using service is not broken down by age, and therefore it's difficult to assess how many people are experiencing abuse and how the services are meeting their need. What we do know, however, is that on average, older victims experience domestic abuse for twice as long as other age groups before seeking help. And there are a number of barriers that they encounter. Sometimes it's because of a lack of awareness of services, or a feeling that the services are not for them. It may be shame or embarrassment, or a fear of consequences. When we looked at the issue of financial abuse, we know that 50% of people over the age of 75 are targeted by scammers, and that's data from the National Trading Standards. Financial abuse, we know, can be committed by anyone. It might be a partner, a member of the family, a relative, or a criminal. And quite often, older people are experiencing a combination of different types of abuse. So what services are available? Well, in terms of Valda SV services, what the research found was that services in principle are available for all adults, but they need to adapt and to improve their response to older people. The research found that there's a lack of older people's voices in the development of services and a failure to take account of their experiences. And very few services focus specifically on the needs of older people. And older people with other protected characteristics, for example, older people from Black, Asian and minority ethnic communities, can face additional barriers. So the report found that there's a need for appropriate accommodation and support services for those needing to leave abusive relationships. On the whole, that accommodation is not geared up to the needs of older people. Services also need to meet the needs of the diversity of the older population. One size does not fit all. The research found, though, that there is some good practice in Wales, including Dow's Choice, the OWL service, the West Wales Domestic Abuse Service, and the IRIS project in health boards, identification and referral to improve safety. So there's some really good practice to draw on and to spread. In terms of financial abuse services, quite a lot of these services are focused on awareness raising campaigns, so getting information out to older people, providing training and signposting people where to go for help. But we found that the language that's used can actually affect the way a concern is dealt with. So whether it's called a scam, financial abuse or fraud may mean that different agencies are involved. So there's a lack of clarity for older people and not straightforward for older people to know where to go. And here again, the limitations on data collection, a lack of age breakdown on data collection, inhibits the development of appropriate services. So good practice was identified, including the Financial Exploitation Safeguarding Scheme in Carmarthenshire. So moving on to some of the key recommendations that the research has highlighted. The first one is the importance now of reviewing and changing policies, procedures and services to ensure they are inclusive of older people, because at the moment they are not. Publicity campaigns on abuse also need to be inclusive of older people. And that means, for example, that the imagery includes older people, but the language is accessible for older people. So when people see those campaigns in the publicity, they can see people like them. And that information also needs to be available in community settings such as pharmacies and elsewhere. Data collection needs to be age related so that we can see clearly the circumstances for older people. Otherwise, people's experiences can be rendered invisible and the data that's needed for planning and service provision isn't there. And there needs to be a significant increase in training on the experiences and needs of older people across public bodies and voluntary organisations and government as well. So looking ahead now, we have some really positive opportunities and developments to respond to those recommendations and to take action. And the Welsh Government has already committed to an action plan to prevent abuse of older people that it started working on and intends to produce by the end of the year. So a fantastic opportunity to work with Welsh Government and to influence that. Welsh Government is also working on the development of a new VALDA SV strategy. So here again, there's the opportunity to be inclusive of older people and to make sure that that strategy delivers for all ages. And we now have the new Domestic Abuse Act for England and Wales, and also the Domestic Abuse Commissioner for England and Wales, who I'm delighted is joining us today. And finally, as our contribution to some of the action that's needed, we have also launched a new services and support directory for Wales, detailing what services and support are available across Wales. And that's available on our website. And at the same time, we've produced a leaflet for older people for those who are not online.